Checking your blood pressure is important. It allows you and your healthcare team the opportunity to assess you for risks associated with elevated blood pressure, such as heart attacks, heart failure, stroke, and even death. Checking your blood pressure at home can be very helpful. It allows you the opportunity to assess what your normal blood pressure can be outside of the doctor's office in a comfortable, familiar environment where there are few outside influences that can affect your blood pressure overall. Thankfully, choosing a blood pressure monitor is not complicated. There are plenty of options available, usually between $50 and $100. They are often available to be purchased through a health savings account. Some offer Bluetooth capability or connectivity with your smartphone that would allow you the opportunity to share your blood pressure results with your healthcare provider. Talk to your healthcare provider about which option might be best for you. Follow these simple steps to take accurate blood pressure readings at home. You'll be monitoring with ease before you know it. Avoid eating, smoking, consuming alcohol or caffeinated beverages, exercise, or taking medication in the 30 minutes prior to your reading. Wear a short sleeve shirt to allow the cuff to make contact with your skin. Find a chair with good back support and sit quietly and comfortably for 5 minutes. This will help ensure you are in a relaxed state. Rest your forearm on a table or armrest to help position the cuff at heart level and support your arm. Wrap the cuff just above the elbow with your palm facing up and arm muscles relaxed. Your legs should be uncrossed with both feet on the floor. Press the start button on your device to begin the measurement. Record your measurement when finished. Wait a few minutes and repeat 1 or 2 times. Average 2 to 3 readings for the most accurate reflection of your blood pressure reading. After 1 week of monitoring, be sure to share your recorded readings with your healthcare provider's office, either through a patient portal or by calling the nurse line. Knowing your numbers is the single most important step in achieving hypertensive control and a healthy heart.